Hi, my name is Gretchen Dobrovich, and I'm the North Dakota Field Director for the Minnesota-North Dakota chapter of the Alzheimer's Association. And today I'm going to be speaking with you about North Dakota Compass, an online tool that I've used in program development and project management. And I'll be speaking specifically about how you can use this tool whether you work for a nonprofit, in the private sector, or for a government agency. We use North Dakota Compass for the North Dakota Dementia Care Services program. The tool was really important in helping us identify where do people who are most likely to develop Alzheimer's disease live in North Dakota, where do people who are currently at the age group who are at the greatest risk for having the disease live, and where are people who are most likely to be caregivers of someone with Alzheimer's disease or a related dementia live. And so we were able to identify where we might place offices, how many staff we might need to be able to serve that area. We were also able to look at how do we budget for all of the resources in particular areas of North Dakota that would be required to successfully meet the needs of people that we would be serving through this project. To identify where the population is most susceptible to developing Alzheimer's disease or a related form of dementia, to be able to look where people in the age group most likely to have Alzheimer's disease or a related form of dementia is currently living in North Dakota, and to determine where caregivers would be living, we needed to look at an age breakdown by location. And so we utilized the demographics tool on North Dakota Compass. By looking at the median age by county, we identified 11 counties in North Dakota with median age older than age 50. We took oldest to youngest by looking at the median age by county so that we could identify where places in North Dakota with large numbers of people with the disease would possibly be living. For counties with an influx of younger population due to the energy development in western North Dakota, we knew that age median alone wouldn't give us a whole picture as who was living in these areas and how we might best be able to serve them. But we still wanted to check the percentage of population over 65 because if younger people were moving to the area and lowering the median age, we knew there would still be a significant number of population who would need our services. To find more information at the county level, we found the geographic profiles were especially helpful. We utilized this profile because it let us know the total population of an area, the median age of the people who were living there, and it also let us know within those age groups who were the people older than age 65, what number of people were over the age of 65. One of the other unique tools with North Dakota Compass was that we were able to look at things that were maybe not usual suspects when you think about program development. Looking at young children with working parents was a tool that was really helpful for us as well, because we know that more and more Alzheimer's and related dementia caregivers may be working adults as well as caring for children while they care for aging parents. We also know that more people are being diagnosed at a younger age with the disease, and so the likelihood of having working parents who are caring for a spouse or partner with the disease was something we wanted to consider as well. This is really great about North Dakota Compass was that there was a variety of different indicators that we could take a look at. It opened up possibilities for us we hadn't thought of. It made us look at project service delivery in ways that we may not have thought of. And it also gave us some surprises about where we thought people were living in North Dakota who were older and where people were living in North Dakota. So it gave us a really good picture about how and where we should be providing services. Resource allocation is one of the areas that North Dakota Compass has been particularly helpful as well in terms of project management and project planning. As a nonprofit organization, being a good steward of the resources that are available to you is important for the Alzheimer's Association. And so being able to utilize the health, the library, age, disparities, all of the different topic areas available on North Dakota Compass became part of resource allocation for me in the process that I went through. One of the delightful surprises is that there are papers available as well on North Dakota Compass, and I came across a very well-written paper that I was able to utilize in not only presentations, but use it as a source for reasoning behind choices that we made in utilizing allocations for resources. North Dakota Compass is a very credible resource, and having a credible resource available to me at my desktop, on my phone, when I'm trying to pull up information, has been incredibly helpful.